I'm Dr. Musa, Senior Consultant, Cardiothoracic and Vascular Surgeon, Kaveri Hospital, Radial Road, Chennai, from India. Today we will discuss one important heart problem, a very complex heart problems for which the patient might require advanced, very complex heart operation to save their life. Today we have one such patient, a 68-year-old man suffering from severe breathlessness and inability to walk because of early tiredness. He knew that his heart problem was there for 1 or 2 decades, and everybody was advised him to undergo heart operation and change of heart valves, but he refused, maybe because of the fear, or maybe because of fear, or he was not having that symptoms, very much symptoms. But recently she started developing very severe symptoms like breathlessness, not able to sleep in the night properly, and sometimes he has to get up and whole night he had to sit up to spend the night, and sometimes he has been taken to hospital also on emergency basis and was admitted in the intensive care units. He is feeling breathlessness even while walking, even a slight few steps, and also he has got a lot of swelling of his legs because of the fluid accumulation. In other words, this patient is already set in to a cardiac failure state, a state of cardiac failure. Failure means it's not the stoppage of heart, it is that the heart pumping power has come down to so low level that he is not getting adequate blood to his all body and tissues. Oxygen is not reaching in proper quantity. So these are all due to some problems in the heart valves. You all know that we have 4 valves inside the heart, 2 on the left side of the heart, 2 on the right side of the heart. These valves are wonderful creation of the nature, and it lasts for a whole lifetime, a person, maybe even 100 years or even more. And these valves decides the direction and limits the flow of blood guides the flow of blood in the heart. These valves are small structures, and it is like a very thin, paper thin structure, but it moves every minute. 1 lakh time opens and 1 lakh time it closes. You mean in a minute? In a minute it opens 1 lakh time and closes 1 lakh time approximately. Then imagine how much it will be, the opening and closure in an hour, in a day, in a year, in 10 years, and if somebody lives up to 100 years without any damage sometimes. So such a beautiful creation. But these valves get damaged by several reasons. Most of them we don't know why, except one or few conditions like rheumatic fever. There is a condition called rheumatic fever. In local languages it is told in a different names. Anyhow, it is a sort of a immunological reaction to, or it is due to sort of a bacteria infecting, usually at the young age, like in teenagers. It affects especially young girls something, and it produces fever, joint pain, and it can subside within few days. Sometimes it is not even noticed. So multiple joint pain may be there in the elbow, and sometimes fever. Sometimes they may have some rashes like that. So if you do the blood test, sometimes you will be able to diagnose it. The EASO titer will be high, and then ESR will be high. Anyhow, this is treated with the antibiotics, and usually the fever subsides. But in some of these patients who have already subsided in every normal, some of them develops what is known as a aortic valve problem, which is called as a rheumatic heart disease. Why in some people this develops over a period of time? Like when they become 15 years, 20 years, 30 years, 50 years, 60 years, like that, we don't know. Anyhow, it is an immunological reaction, and there must be some relationship of the immune or genes between these bacteria and our heart valve tissue. Anyhow, nowadays this disease of rheumatic fever is much less in our country, especially as we are developing more and our lifestyle has improved. It is still there in many other parts of the world, like African countries, where their lifestyle has not improved, and still the people live in a very crowded places. In our country now, people, the crowded living has come down, has steadily come down. But still these rheumatic heart disease are there. So this is one of those kind of a case who had a probably rheumatic fever in his childhood, and now he has come with the heart valve problem, which has reached to its last stage, or I can say it is crossed beyond the optimum or last stage. Now whatever he gets now is luck only, and if he comes out, it will be a very good life for him. What happened in this case is there are three valves affected. Two valves directly from the rheumatic disease, and one is secondary, or in sequel it will be two other valves. So there are two valves on the left side of the heart, what is called mitral valve. Another one is a aortic valve. Both are calcified. A lot of calcium is stuck to the valve, degenerated, and they become very small. The opening is small, thereby not allowing the blood to go through or pass through the heart. Secondary to this, his lung pressure has gone up almost near to our blood pressure. Normally lung pressure is something less than 30 millimeter of mercury, whereas our systemic, our blood pressure in the body is around 120 to 180 or 140. Here it has gone up to, the pulmonary pressure has gone up to 110, something like that. So because of these changes, the right side of one of the valve, what you call tricuspid valve, is become a big, and the blood is flowing in the reverse order, which we need to correct. So altogether this patient needs a two valve replacement and one valve repair. Along with that, he has got a coronary artery disease, that is a heart disease associated with heart attacks. So one of these arteries is blocked, so we need to do a bypass on that artery also. So altogether we can say this patient needs 4 corrections at a time. One bypass operation on his heart, repair of one of the valves on the right side of the heart, and replacement of 2 important valves on the left side of the heart. So 4 operations done in a single operation. 4 correction is done in a single operation. So that is a very important thing. We have to be very careful, and it is going to be a long surgery, at least 7 hours plus. So we need to connect the patient for heart-lung machine, then keep his blood circulation to the heart-lung machine. We need to reduce his body temperature while doing surgery. Then we need to stop the blood flow to the heart, and we need to keep the heart still. That means it is not contracting, it is kept at rest for at least 2 to 3 hours. After that, we expect that the heart will recover. What we are going to do is we are going to replace, that is remove 2 valves from the left side of the heart and replace it with mechanical or man-made valves, which are imported valves, and also we get from Indian-made valves also. So that will remain there. We stitch it back. One of the valve will be repaired and the block will be removed. This way we are going to do this thing, and hope he will do well. And after the operation, once he recovers, we expect him to his symptoms should subside. Over a period of time, he should be like a normal person only, and he might have to continue few medications. One medication, one of very important, lifelong medication, what we call blood thinner, and other medication as long as his body condition needs. So we expect him a good life, good recovery. Please pray for him so that he will come out with good success and live a long life.